Hello friends, in this video we are going to discuss about the different planes and the terminologies related to those planes. So first plane which we are going to discuss is the median plane. Median plane. It is the plane which passing or which divides the body our body into the two halves, the right half and the left half. And with the respect to this plane, we can study the two terminologies. One is known as the medial and another one is known as the lateral. These terminologies are relative terminologies. The part of the body which is towards the midline, it is known as the medial, and the part of the body which is away from the midline, it is known as the lateral. So if I say I have 3 points, one A, B and the C point, then you can easily say that this A point is towards the midline, so A is medial to B. And if I want to describe the B, then I can easily say that the B is medial to C. But lateral, I can easily say that B is lateral to A because it is away from the midline with respect to A. And the C point is here, so you can easily say that the C is lateral to A as well as the B. So the parts of the body which is away from the midline, it is a lateral, and the part of the body which is towards the midline, it is known as the medial. Very good. Now another terminology which divides, or another plane which divides our body into the anterior, you can say front and the back halves, then plane is known as the coronal plane. Yes, here there is a coronal plane. You can easily say that it is dividing our body into the front as well as the back. And with respect to this coronal plane, we can define the anterior as well as the posterior. Actually, the point which is towards front side, that is known as the anterior, and the points or the parts of the body which are towards the back side, it is known as the posterior. If I say into the frontal bone some A point, then the B point, and the most posterior C point, then you can easily say that the A is anterior to B and B is anterior to C. But you can easily say that the C is more posterior, it is posterior to A as well as the posterior to B. That's how you can define here some points. Now the third plane which is known as the transverse plane, which divides our body into the upper as well as the lower halves. So transverse plane can be, any transverse plane can be there in our body. So the points which are towards the brain side, that is known as the cranial, or you can say the terminology with related to that, that is a cranial. And the points or the parts of the body which is towards the below, that is known as the caudal. So cranial as well as caudal. So you can easily say that this frontal bone, these all things are cranial. So that is also relative terminology. If I say some point D, then the E as well as the F, then you can easily say that D point is cranial to the E and E point is cranial to the F. As well as you can also say that the F is caudal to the E, or you can say easily E is caudal to the D. So that's how the two relative terminologies, cranial as well as the caudal, with respect to the part, whichever part is more towards the brain side, that is cranial, and the more towards the lower side, that is known as the caudal. As well as some another terminology with related to that is also known as the proximal as well as the distal. So what is proximal and distal? If into my upper limb, some structure is here, one muscle is here and another one is here, so I can easily say that this point is distal to this. You can easily say that forearm is distal to the arm and hand is more distal to the forearm. And you can also say that the proximal is also towards the center side. So this arm is more proximal to the forearm and forearm is more proximal to the hand. So that's how terminologies, proximal, distals are also used. Now we will see some important movements of our body. Into the baby also you can see here the planes also, the median plane and the planes which are just parallel to the median plane known as the sagittal plane. That's why the median most plane is also known as the mid-sagittal plane. The transverse plane as well as the coronal plane. Here there is one suture is also there which is known as the coronal suture. Great. Now, what is a flexion and what is a extension? So when our two body surface area, or you can say they are coming near to each other, then it is known as the flexion. Just like our forearm is moving towards the arm, then it is known as the flexion. But the opposite the flexion, it is known as the extension. Extension, E-X-T-E, extension. So here that is known as the flexion, this is the extension. Here you can say flexion, extension, into the hand, flexion, extension. Then the another terminology which you need to remember, adduction and the abduction. So you can easily say that when the limbs or the parts which are when moving towards the midline, that is known as the adduction. Add some of the things, adduction. And when it is going away, then it is known as the abduction. Bad baki, abduction. Okay, fine. So adduction, abduction. As well as when it is moving the round complete movement, that is known as making a complete circle, then it is known as the circumduction. With respect to the transverse plane, I just forget to tell you, that is also known as the superior as well as the inferior. Into the same terminology, into the DEF, into the this DEF, you can easily say the D is superior to E and the E is superior to the F. So the part which is upper side, that is known as the superior, and the parts of the body which is lower side is known as the inferior. So into the anatomy, when you know these all terminologies, then you just place yourself into one particular part of the body and describe all the structures which related to these terminologies. Either it can be medial, it can be lateral, it can be anterior, it can be posterior, it can be superior, it can be inferior, it can be proximal, it can be distal, as well as it can be cranial, it can be caudal. So I hope you all have understood these terminologies. Thanks for listening.